So very good afternoon, all of you. Without delaying the session, I would like to start the session. And so today's webinar topic is Global Healthcare Staff Challenges. And today's speaker is Anitha ma'am. She is a principal in Madhubani Medical College. And so, Anitha ma'am, are you available there? Anitha ma'am, are you available? Are you able to hear my voice, ma'am? Ma'am, are you available there? Sorry for the inconvenience occurred, ma'am. She was facing some technical issue from her end. So just wait for a while. She will be online. Anitha, ma'am, are you, am I audible to you?
Yes, ma'am. Yes, ma'am.
Ma'am, I have shared your slide. So, hello,
Yeah, ma'am.
ma'am, are you there?
Yes, ma'am.
Yes, ma'am. Ma'am, I have shared your slide. You can continue with the session, ma'am.
Yes, ma'am. Hi, everyone. Good afternoon. Myself, Dr. Anitha Jyothi, working as a principal, come professor. And today, a very interesting topic I would like to discuss on live webinar is global healthcare staff challenges. I request audience to keep the mute. I'll give you time for the discussion in the last. So healthcare staff care challenges, especially today, I'm going to discuss from the paramedical side, like nursing students and the nursing officers, PhD scholars, and the nursing faculty. And this is a very interesting topic because everybody is facing in day-to-day life this issue, and we are struck up with challenges. And today, at the end of the session, I would like to suggest some important strategies how to solve these challenges in day-to-day life, being a student, being a nursing officer or nursing faculty. I'll give you some sort of small strategies so that you can improve your quality of life and you can improve the quality of the patient care also. That is what my main motto to select this topic in the live webinar. Let's see, we'll see that agenda for today's discussion is staff care challenges global. So I'm not discussing only limited to the certain parts of India. We are discussing the global healthcare staff challenges. And from 2:30 to 2:45, I'll discuss the resolving strategies, how we can solve the challenges in our hand. And 2:50 to 2:55 p.m., the open discussion will be there. We can have a conversation like what kind of strategies we can follow to reduce the stress or the challenges in our working environment. And 2:55 to 3 o'clock, I'm going to summarize and conclude the topic. Yeah, my target population, which I have mentioned already, I think other than paramedical staff, I think some of the doctors also joined in this session. I'm happy for that. And my main target population, which we are facing in the day-to-day life, is nursing students and the nursing officers, faculties, PhD scholars, and other healthcare professionals from our medical college. Some of the doctors also have joined because we are all come under healthcare professionals. Leave about the categories, but everyone is facing same kind of problems. So we will try to discuss one by one what we can do with starting with the introduction. Yeah, well, we know very clearly the healthcare system completely depends on skill, because the other professions, compared to other professions, the healthcare profession has this peculiarity. If we have a skills, and I think 80% of the challenges we can achieve, because everybody is facing challenges in different fields, but our profession has a certain special skills. If we have that skills, I think most of our challenges also we can resolve it, and we can reduce our burden also. So workforce, always globally, there is an increased demand for healthcare staff, and there is a limited supply. And obviously, when there is an imbalance in the demand and the supply, we have a crisis. That is what the problem now in India or in the abroad also we are facing these kind of problems only. We'll have different things, how the staff nurses or nursing faculty or the nursing students, how they are facing, we'll see one by one. So the first one, as I have discussed, global healthcare staff are facing confluence of systemic, professional and personal challenges that threaten workforce stability and patient care quality. Here I would like to speak the three things. Is these challenges are affecting system, that means the total healthcare delivery system, and second thing, it is affecting our profession, and third thing is it is affecting the personal challenges also. I think this is a very interesting topic. We can get a very interesting knowledge also from here. So what is happening when the system, healthcare system or the professional or personal challenges are increasing? It is causing workforce imbalance in the workforce stability and patient care quality also. So according to that, a projected shortfall of 11 million health workers expected by 2030. That means among, I'll show you the statistics also, among total healthcare professionals, including doctors, nurses, pharmacists, and dentists, we are the healthcare professionals, especially staff nurses and other healthcare professionals covers most of the shortage. So we'll see that 11 millions, according to WHO calculation, 11 million shortage is there in India and in abroad from the staff care. Next, we'll see how the staff nurses are facing. So according to the challenges faced by the staff nurses in India, requires a multi-program approach. It doesn't mean that the staff nurses provide everything, means the healthcare delivery system or quality. Here we should say it is a multi-programmed approach that tackles the severe workforce shortage, high turnover and poor working condition. So when it comes to staff nurses, there are nursing officers. When it comes to the nursing officers, only 3 points are major challenges in India we are facing. That is, first one is workforce shortage, second one is high turnover, and third point is poor working conditions. These three major challenges the nursing officers are facing, and later we will discuss how we can solve these kind of strategies. This is about staff nurses challenges. Next we'll see Next, we'll see how nursing students, we are always, so because our career starts from the clinical training of the nursing students. So I believe even the nursing students also facing in regarding providing services or regarding the clinical training, they are also facing some kinds of challenges. Here, I would like to speak out only few main important aspects, like they have a high stacks in clinical training because as per INC curriculum, we have every semester sessions and clinical exposure. So that is a one of the burden for them that they have to complete in prescribed curriculum. And other thing is extreme stress. Extreme stress is because they are exposed to the required hours, but apart from that, there may be other challenges that they are able to accommodate with the environment where they are getting training. And next one is burnout. Burnout means most of the students we can see in the recent days, like why we have to do. So why we have to do it, and other thing is anxiety. Anxiety is another important challenge the nursing students are facing because they have a huge gap between the theory and practice. So what is we are teaching in the skill lab that makes a lot of difference implementation in the college hospital side. So that is a major reason. Even the nursing students also facing challenges since most of the students also participants in these challenges. So I would like to include their problems also, and we will try to have some strategies at the end of the session. Next one is nursing faculty, because my target population I have mentioned already. Nursing officers problems we have discussed, nursing students discussed, and even the nursing faculty, PhD scholars, and other healthcare professionals I would like to discuss means you can see very clearly in the slide. Nursing faculty in India face significant challenges, including severe staff shortage. Severe why we are mentioning is at least staff shortage is from 50%, it is okay, but severe why we are mentioning is 86% of the vacancies in some colleges, because recently few faculty are trained with a different higher qualifications, but still we have a high shortage for the faculty, and because of that heavy workload, and the third strategy is that poor pay parity compared to the other academic discipline. If you go to the government schools and government colleges, there the pay scale is entirely different from the private institutions. So obviously the nursing faculty is facing these three problems, that is heavy workload. Obviously I agree, because as 86% of shortage means mostly the faculty are facing heavy workloads and poor pay, because as per the norms, we are not able to fulfill the criteria, and as per the student strength, we are not able to pay high pay. So that is also big challenge for the nursing faculty. And parity compared to other academic disciplines. This is already I have mentioned. In different private schools and colleges in India, we can see lot of high pay in the education side, but when it comes to the nursing side, there is a little difference. So that is a major challenge nursing faculty is facing. And we can see the global statistics. WHO estimates shortage of 10 million health workers by 2030, and nurses form a largest workforce group in the low economic countries, like example in India. So if you see the slide, I would like to share the slide with the statistics. How much healthcare professionals, if you can zoom out and see, and among a last slide, the green color slide is representing that the nurses are the highest contribution for the healthcare services. From that, we can see more than 29 to 30 million population shortage is there in the worldwide. Then compared to other the doctors, pharmacists, and dentists, all these people shortage is very less compared to the staff nurses. You can see very clearly this is the shortage we are facing challenges right now in India and as well as abroad. So let's come to the today's topic. The overview challenges, if we take a staff nurses or student nurses or PhD scholars, faculty, and other healthcare professionals, the overall challenges what we are facing is, the first one is staff shortage. Second one is, obviously, when there is a shortage of staff, we have workload and burnout. And third one is skill gap. Yes, regarding this, we will discuss in detail, because most of the healthcare professionals are facing difficulties because of the skill gap. Because the theory, what we are learning, it is not matching with the practical. The theory, what we learn in the skill lab, sometimes it is not matching with the real life practice. So the healthcare workers having the confusion, and that confusion creates again the stress, or it can lead to even the imbalanced professional life also. So the skill gap, and that can lead to unequal work distribution. So this thing, I think some of the doctors and nurses also is here, and healthcare nursing faculty also present in this session. I can say very clearly that what is happening is, whoever works, and those will get more work, and whoever is not having that skill, they are getting less work. So obviously there will be a work distribution also, disturbances will be there. Ma'am, can you share the previous slide, Manisha ma'am? Yeah. So when there is an unequal work distribution, obviously there is a lack of recognition and poor working conditions. I think everybody has connected with this topic, and these are all the common problems we are facing wherever we are working. And we'll go with one by one how the problems are, challenges are facing by the healthcare staff, and how we can resolve it. So among that, the highest problem we are facing is, yeah, next slide, ma'am. So I think we have already discussed. Yeah, the first problem I would like to discuss is staff shortage. So the staff shortage, how it is affecting on healthcare staff. I'm not going to discuss that the staff shortage is there throughout the world in different fields, but how the healthcare staff shortage is affecting on the individuals. So there is a obviously increased patient load, and when there is an increased patient load and reduced staff, and patient staff ratio is reducing, definitely then can lead to reduced quality care. And sometimes most of the hospitals and even the nursing colleges are giving more working hours to complete our task. So what is happening? So ultimately, who is affecting? Ultimately, who is affecting? So the person who is affecting is healthcare professional. It includes the nurses, student nurses, then the other healthcare professionals. How it is affecting the shortage? So when there is a shortage, one nurse is providing a service to the 30 patients, obviously quality of care is reduced. Sorry, quality of care will be reduced. And when quality of care is reduced, then there is a patient turnover also reduced. The death rate is also very high. Ultimately, it is affecting the healthcare delivery system in the world. Healthcare delivery system in the world. So obviously, staff shortage. So can anyone give you any suggestions that staff shortage can be, how we can solve? From the audience? Anybody want to have that, how we can solve the staff shortage to reduce the challenges by the healthcare staff?
Vital equipment.
Okay, then? Or anyone?
Uh, Hello, ma'am.
Yeah, please, please.
Am I on? Yeah, staff shortage in nursing can be reduced by improving salary and work environment and staff-patient ratio.
Yes, yes, very
Like
important point.
providing better support and respect for nurses. Retaining the experienced staff is equally important as well as recruiting new nurses. In my opinion, I'm just stating.
Thank you for your wonderful information. Yes, obviously, these are the important points. If you are focusing, obviously, the staff shortage can be reduced. And if staff shortage we are able to manage, means ultimately quality of care will be provided and healthcare delivery system also can be improved. Okay, ma'am, can you share that slide? Manisha ma'am, can you share that slide, previous slide? Okay, so here I would like to discuss that the staff shortage we are saying. What is government is doing? Government is recruiting different notifications. I have seen nowadays in the north side, especially in Bihar and some states, they have released a lot of notifications. I believe that the government notifications is one of the strategy we can able to compensate that staff shortage. And apart from that, from the private institutions also, if the recruitment process they are increasing, then ultimately there will be a reduced workload on the employees, and the quality also we can expect, especially in the nursing college side. I'm expecting that if new recruitments are there in the even in the government colleges or in the private colleges, ultimately we can improve the quality of education system also.
Hello.
Yes.
Everyone is able to see the slide? Ma'am?
No, ma'am, no.
No,
One
no.
second, I will share.
No, ma'am. No,
One
no, no.
second, I'll share. Okay. I'll share it again.
So my dear students, I am speaking only English because from different states also audience are participated. I cannot use either the local language, Hindi also. I try to follow the things. Audience can able to understand the topic?
Yes, ma'am. We understand that.
Yes.
Yes, ma'am.
One second, ma'am. I'm just sharing the PPT.
So already we have discussed.
One second, ma'am. I'm facing now some issues.
So that's the first issue we have discussed. And what are the other challenges we are facing in India by the healthcare professionals? Is there any other issue? So first staff shortage we have discussed. And the second one, what are the major issues we are facing?
Not
Pay scale, right?
similarities, not giving similarities healthcare provider, so that it is a big issue in India right now.
Yes. So yes, the staff care challenges. Second point, important point is that proper remuneration they are not getting. The proper remuneration they are not getting in their lower level to higher level. And we are having a lot of years of experience need to be required to fulfill our criteria. So what is happening here is remuneration. Remuneration, when we want to discuss, I think nowadays the government also has revised schedules regarding the pay scales. Like they are paying 7th pay scale, 8th pay scale. So in the government sectors, that is all implemented. So if our governing bodies also is fighting for this unity of the pay scale, definitely we also can overcome with these difficulties. So the government, how they have implemented the strategies, the same way private schools also can take the chance, private colleges also take the chance to initiate the remuneration for the staff nurses or healthcare professionals. Similarly, obviously we can have a universal standards for the salaries. And proudly I can say, because since India is a developing country, we are facing this difficulty. But in developed countries, the nurses are the highest paid skilled employees. Proudly I can say nurses are the highest paid skilled employees. That means in abroad we have a remuneration strategies very equally according to the quality of education, according to their standards. But only India is facing this difficulty. But from our the participants, whoever is there in the head of the institutions, if they can take a step forward for the hike of the remuneration, definitely it can be a good strategy. Any other challenges now? Second, so two discussed we have. Yeah, third point, anybody want to say any important challenges we are facing? Remuneration discussion we have done. So remuneration, I believe, is one of the biggest challenge we are facing. And other thing is, this challenge is making the employees motivation or demotivation also. There are employees who work dedicatedly because of the salary. There are employees who are completely demotivated because of the remuneration. I believe that remuneration is one of the important motivating factor for the healthcare employees. So how many agree with that? Can you raise your hand? So remuneration is one of the motivating factor for the healthcare professionals to provide quality of care. Even though shortage of staff is there, they can work effectively.
Ma'am, I mentioned the important things about a part of the salary. The challenges means, ma'am, included is the violence and harassment for the according to the patients by the for the doctors and nurses is the most important. And I think, ma'am, second part is the infections, diseases is the main major challenges in the our professions, ma'am, a part of the salaries.
Yes. The third challenge we will discuss here is that what he mentioned is we are the nurses, especially healthcare professionals are facing exposed to the infectious diseases. So for that, what we can have is we cannot avoid the duty or we cannot stop interacting with the patient since our field is interaction with the patients. So we cannot stop. In that case, there is two techniques. The protection should be provided by the individual, and second technique is the protection provided by the institutions. So suppose institution is saying like there is a shortage of PPE kits, then we cannot just blame that the institution is, we are at the risk. Being an individual, we are at the risk. We have to have our own protection. We have our own protection. Among that, one of the leading cause right now in some of the states are like HIV, we are not seeing that many cases, but tuberculosis is widely spreading right now in India. How to use every time the mask. And whenever we are interacting, especially casualty nurses, you have to use the gloves whenever we are touching the patient, because we cannot predict that any any patient is healthy, we can touch. That prediction should not be there. Everyone we have to treat like they are infectious, and we have to protect individually. Individually, we have to protect as well as we have to protect the institution also. Okay, very good. That's a point we have discussed. And second one is harassment. Yes, I think 10 years back, this harassment in the healthcare profession is very high. If you see the statistics, healthcare professionals are not facing that much widely harassments. There are few institutions, internally the harassments are happening, but externally or by the displaying concepts are not there in most of the institutions, because institutions, especially the medical college, hospitals or nursing colleges, they should keep some standards and some protocols regarding this harassment. Then only the healthcare professionals can be safeguarded, and the strategy should be maintained like we have to take immediate action whenever there is a some indiscipline or some of the harassments happened in between the healthcare employees. There should be equal judgment for all healthcare professionals or whoever doing the mistake. So anything else? Very good. The 4 points we have discussed, very important points. Any other points? Audience, any other points?
If government policy, how can support the healthcare in our system? In privatization also.
in private or in the government sectors, I think the government is giving a lot of opportunities. And I think recently one of the staff nurse raped by somebody out of the campus, out of the hospital premises. Still the government has reacted and has given some punishment. Only we are facing a challenge, that shift duties. That shift duties, it is not only by the healthcare professionals, it is faced by even the software employees also. So when it comes to the safety, they are giving women's safety one portion, another second type is that healthcare safety also. The government has to take immediate action whenever there is a incident happen. When we are thinking about the government part, first thing from our institution, we should initiate that incident report. Then only the government can take the action according to my perception. So is there any other points you would like to discuss, Rajiv?
Not now, ma'am, till later.
Yes, fine. Thank you. Is there any other points, ma'am? I'm telling you, even if any HODs are there present in this webinar, I'm requesting, make a policy in your institution, whether it is a small school of nursing or college of nursing, it is a medical college or at a hospital, we should have a framed policy to protect our healthcare professionals. That these kind of situations are offensive or punishable. Such statements we need to have in the policies, so that obviously healthcare professionals can be safeguarded. When we have a fear of the punishment, definitely there is a fall of that risk also. Is there any other points, ma'am? Is there any other points you would like to discuss?
Yeah, good afternoon, ma'am. Hello.
Good afternoon, ma'am.
Good afternoon, ma'am. My request to your workers. Medical.
Yeah, please proceed.
Ma'am, how should we tackle from lack of training and skill development with the nursing staffs?
Yes, this is an important strategy. The government and the private collaboration, lot of organizations came into the force to reduce that skill gap, because most of the healthcare professionals are facing the difficulty because of this issue only. Because, my dear students, now so many are present, even my students are here. We are thinking like, we can study later, or we can go to the working, then we can learn. So what is happening is, when you don't have the knowledge, you cannot put into the practice also. When you don't have the knowledge, you cannot put into the practice. So that makes lot of stress, psychological and physical stress, among healthcare professionals. So why I'm insisting, during the education system itself, if you have a proper training, I think 50% of your challenges can be achieved in that area, in the practical area. So sorry for the interruption. There is a network issues in displaying slides. Just hold on. Yes, ma'am, please start from this slide only. Yeah, so here we have discussed staff shortage, the first point, and some of the important points like remuneration also we have discussed, some of the risk of infection, risk of injury, and physical harassment we have discussed. Among that, healthcare professionals are facing another important point is workload. So workload, why the workload is increasing? It is a previous factor is another factor, like staff shortage is only causing workload. But I believe another very, very important factor is there for the workload is we don't have a proper theory and proper practice during our education time. Because theory and education during theory and I request the audience to mute the mic. Okay. So when there is a staff shortage, that can lead to workload. But workload is affecting individuals, especially healthcare professionals, like physical and emotional exertion. So everybody, even today, whoever is present here also, everybody, because of the workload only, the healthcare professionals are facing physical and emotional exertion. So any difference, physically or emotional difference में ऐसा कुछ difference है?
Yes, ma'am.
Yes, what kind of physical workload can increase what way physically in your body? What way we can expect, like when we have a workload, obviously our body is tired. Our body is tired and we become weak. So when there is a weak, obviously we will have an exhaustion in performing the task. When we have an exhaustion in performing the task, obviously there is a quality of care will be reduced. And we can see here the second point is emotionally, if you are burnout, then it can lead to stress and fatigue. And next one is ultimately when you are physically tired and emotionally tired, job satisfaction will be good or bad? Yes, job satisfaction is good or bad. When we have the physical emotional workload is more, then obviously the job satisfaction. As anybody can say that how workload habit is affecting on the healthcare professionals. Now tell me how we can reduce this physical and emotional stress. How we can reduce this physical or emotional stress or workload, and what are the strategies we can follow to improve our healthcare staff?
Good afternoon. To reduce this physical workload and stress, I think for our nurses, like it is a health challenging also. Health should physical exercise.
Yes, ma'am.
Yes, ma'am. Like we need proper physical rest and sleep, and we need to do some workout by doing like yoga,
Yes,
meditation, and yes, ma'am. Others
yes,
things which will help us to overcome these physical challenges, ma'am.
Yes.
So these are the things I want to contribute for this physical workload.
Yes, ma'am. Thank you for your valuable points, ma'am. Here I would like to say, you can see the images very clearly. Because of the heavy load, the nursing faculty also feeling physically and emotionally stressful, and nursing students also facing the same problem, and even the staff nurses or nursing officers and other healthcare professionals are facing same problem. Because of the work heavy load, there is a two consequences, physical as well as emotional. So most of the healthcare professionals are struck up with this point only. So I would like to suggest some of the strategies, because we are facing the challenges and our life is end up with the challenges only. I am requesting, there are small strategies you start initiating. The madam has mentioned very important points, because we should take care of ourselves. Self-care is very, very important. Yes, obviously nurses, nursing officers will say that we have family, we have kids, and we need to balance the work shifts. And these all things are there. But apart from that, we have to focus on the individual care also. Individual care, like madam has mentioned, like some good rest and sleep. We say work is there, but that work can increase your burden more. So in spite of that, you take a good rest and sleep, and have a good exercises, and have some recreational therapies. Because always 24/7 or 30 days we are focusing on only on the problems, we cannot feel happy, and this workload one day it will affect our health, like physical diseases as well as the emotional diseases. Can any one of you say that what kind of physical diseases can affect the healthcare professionals? It's a very important, interesting topic. From audience, anybody wish to specify what kind of physical health issues can affect on the healthcare staff? The healthcare staff doesn't have any physical health issues because of this workload, heavy workload. Yes, any one of you? Yeah, because
poor quality of care, or
okay.
shortage of healthcare or limited access healthcare, sir.
Okay, limited healthcare services. Here, the point is like my question is heavy workload can lead to two effects on individual, especially healthcare staff, physical effects and emotional effects. So suppose if you are facing a heavy workload for long years, what kind of health issues will come to the healthcare professionals?
Like varicose veins from prolonged standing and
Very
sleep
good, very good.
disturbances, headaches, hypertension.
Yes, because of the workload and the stress, it can affect the diseases like hypertension. And some of the nurses are facing even the early detection of the diabetes. Pre-diabetic cases are diagnosed because of the heavy workload and the stress. And some of the emotional effects also is there on the family because they have the family disturbances, personal life disturbances. These kind of effects also healthcare professionals are facing. So what we have to do? Challenges are there, but what we have to do, this one is like we have to concentrate on our self-care, like having some relaxation techniques, recreational techniques, and we should focus on solving the problems instead of focusing on the problems. So this is a workload points I would like to conclude. And next we will go to the third important challenge that nowadays the nurses are facing. So next slide. Yes, this is a very, very, very important challenge the current generations are facing. Sorry to say this word, that the current generations are facing, because the current generations are thinking like we can learn while we work. Again, I'm saying the sentence that they're thinking like we can learn when we join in the job. So what is happening is training 4 years of curriculum or 3 years of curriculum, 2 years of curriculum, why they have given is that to learn certain theory parts so that that theory can be utilized in the skill area or utilized in the hospital area. But what this generation is thinking like, just the curriculum should complete, we can learn there. So what is happening soon after joining as a healthcare professional in the hospital or in the nursing college, they have a huge gap of training and skill. And they got the job, but they don't have the skills. So when you don't have the skills, what will happen? How it affects on the individual? How it is affecting on the individual? Obviously, the quality of care will be affected and you will not be appreciated anywhere, and you will be disrespected by the institution or disrespected by the colleagues, disrespected by the students, disrespected by the patient. Patient immediately is judging. She don't know how to give injection. So why these things are happening is the important slide which I want to mention here is every student must remember the training and skill gap. Yes. So what is happening is most of the nurses are even the 40 years, 60 years experience, they don't have updated knowledge. There are a lot of techniques came for the performing nursing procedures. We should update the knowledge. And second thing is limited training opportunities. Yes, 100% I agree. In India, most of the nursing institutions doesn't have a proper training opportunities. Because of that, they never touch the injection. Because of that, they never had exposure to dealing with the patients. They don't have opportunity to do certain kinds of procedures like catheterization or assisting in certain kinds of procedures like cannulization. So what happened is This all is affecting the skill. So when skill you don't have, obviously the healthcare professionals 100% you will face the challenges. So in this live webinar, I would like to suggest definitely training and the skill has to be done by each and every healthcare professional in your respective field. Whether you are a student nurse or a nursing officer or the nursing faculty or PhD scholar, I request everyone to update your knowledge. Along with that, you should have some training opportunities. And most of the time, we have these two. Knowledge is there, then training also is there, but we don't have a technology updation. A best example, we know about mechanical ventilator and we know the skills how to operate a mechanical ventilator, but mechanical ventilator also have some modes, system, that technology we are not updated. So what is happening is this training and skill gap is causing a lot of disturbances on individual, on professional life, on healthcare delivery system. So on healthcare delivery system is affected means ultimately the output of the quality care also obviously will be followed. Yes, is that clear? So this training and skill gap is one of the biggest challenge we are facing in day-to-day life. So we'll see how we can solve this one. Ma'am, next slide, please. Yes. So I have mentioned very clearly when there is a training skill gap, what is happening? First thing, doctor or any higher professionals will order that, sister, get me this one. Best example, infusion pump. You never seen in the college training level, you never exposed to the skill training also. Suddenly doctor has advised to start infusion to the patient. So you don't have training, you don't have skills. And third one is you don't have the technology knowledge. So obviously healthcare professionals have a question in mind that how to operate this. This is the image is indicating like how to operate. Next one, we have missions, everything in our hand, but we don't know that what to do with that missions. So this is the image. Best example, medication errors. My dear students or other faculty or other members of this live webinar, here we are facing these difficulties because we are not learning. We don't have the skills. So ultimately, when you don't know how to use the equipment, when you don't have the knowledge, you will have a stress and anxiety in the working area. So ultimately, this can lead to confusion state. This can lead to lot of errors. This can lead to death of the patient. This can lead to the reduce the quality of care. There are very bad reputation for some hospitals. From where this reputation? Why? Because we don't have the training and skill that leads to the damage or the reputation of the institution. So what is happening here? And it ultimately decreases the quality of the patient care. And maybe if you are not able to compensate with the current challenges, you may walk out. Oh, I'm not fit for the education field. I'm not fit for the staff nurse field. I'm not fit for the PhD, or I'm not fit for so and so. What we will do, we'll try to change the jobs frequently. Job turnover will be very high when you don't have a training and skills. My dear students and the faculty, you should have this knowledge and skills correlation. Then only you can have a quality of care. So, and other thing is the third point, which I'm showing the cursor here, delayed response in emergency situations. When you don't have the knowledge and when you don't have the skill training, obviously there is a delayed response in emergency situations. Like doctors has ordered code blue. Doctors has ordered code blue, but our students or faculty never heard about code blue. What is code blue? You should learn in the theory. Then only you can implement in the skills. Then only you can implement in the emergency situations. So 2-3 times the healthcare professionals will say ready for code blue, and 3 situations you failed. Ultimately, you will not get any appreciation, and you will be treated as a low profile nurse or low profile healthcare professional. We are creating our own level to the top because of this lack of training and skill gap. The next. Yes, this image, I can literally say that unequal work distribution. in India, this is the biggest challenge everywhere we are facing. Some healthcare professionals do double work, and some healthcare professionals will do only 20% of the work, and rest all work will be distributed to the other employees. So what will happen is some staff is overloaded and some staff is treated like a delegates. So what is happening is ultimately the some staff is overloaded. Ultimately it can leads to poor task delegation. यहाँ पे मैं एक एग्जांपल देना चाहिए. ऐसा मेरे को 2 घंटा 3 घंटा क्लास में हमको 5 घंटा क्लास मिला है, और 8 आवर्स ड्यूटी में हमको 2 शिफ्ट्स मिला है. Obviously there will be a poor quality output and it can leads to team imbalance also. So these are the things we can see. Madam, can you next show that image? Unequal work distribution. Yes, wonderfully you can see this image. Some are overloaded with the work where they don't have any space, and some are enjoying their time with the mobile or with their personal space, all these things. So what is happening is when there is imbalance in the work distribution, quality of the care will be affected. Quality of the care will be affected. In this unequal work distribution, I request any HODs or any other higher professionals are there, I request make sure that all the employees get equal work distribution so that we can give a quality of care and we can improve the quality of the institution also. So here you can see all the images. Madam, can you zoom in? So what are the effects on the staff nurses and what are the effects on the faculty in the education system? When there is a unequal work distribution, some of the employees will get demotivation, and it starts with conflicts, and it starts with there is a colleagues within the colleagues also there will be a imbalanced professional relationships, and that can leads to quality output only for the patient care, for the individual, for the healthcare system also. And when it comes to the healthcare, nursing faculty, if you give some work to some employees and some teachers are getting relaxed, so what will happen? Yeah. So this is a major thing we have to think, that equally we should have the working hours so that the quality in the education, quality in the healthcare services also we can improve by having a proper leadership and proper supervision. Next slide, ma'am. Yes, so one of the staff, one of the member, here they have mentioned like working conditions. Working conditions like inadequate resources, long shifts, and unsafe environment, which topic is already one of the person has mentioned, like safety. The safety is making more challenges in the present days, but I believe compared to 10 years right now, we are more secure and more safe because most of the institutions are installed with CC camera and covered with some CC surveillance. What is happening here is when you are coverage with some this kind of facilities, ultimately even healthcare professionals also safeguarded because of this system. And every institution should have standard policies. Every institution have that standard policies for the healthcare professionals. If you do such kind of activities, there will be a disciplinary action against you, so that healthcare professionals will be safe and you can reduce even the unsafe environment also. It can be a physically, sexually, or even with the emotional environment. Environment, it doesn't mean always the outside environment within ourselves also. Internal environment also can be healthy if you make a equal working hours, then constant supervision, all these actions. So inadequate resources is biggest challenge healthcare professionals are facing. Why? The 100 patients are there, but the healthcare facilities are provided only for 50. Best example, 50 beds are there, but admission intake is 100. So each bed is occupied by the 2 patients. So what is happening is these inadequate resources should be planned and organized by the head of the institutions, either it can be government or it can be private institutions. Okay, next slide. So with this limited resources, Who will affect ultimately? Any higher management or any political leaders will affect with these limited resources. Obviously, the third level, the employees who are really working with the people who are really implementing the institution policies. So for this also we have same problems like insecurity, and we will be physically drained, emotionally drained, because patients are fighting with us, and we don't have resources, and the management is saying like tomorrow it will come, the next month it will be fulfilled. Either government or private, the same situation is going on. So with these limited resources, ultimately the healthcare professionals are affected. So what we have to do? What we have to do? Day-to-day life, every time we need to update our requirements to the government, or we need to update requirements to the private institutions so that they can start implementing. Instead of 100% of the success, we can try to give at least the 10-20% also, the satisfaction. So here, mostly these strategies can be provided whenever you are feeling the 3 points I have discussed. Inadequate resources can be solved only with the management strategy. Second one is unsafe environment. My dear students or employees, when you feel insecure in your environment, try to convey information to your head of the institutions. Try to get solved from there, and try to have supervision from you in the institution so that the unsafe, just kindly mute you. So whenever unsafe environment you are facing, definitely you need to have safe environment by inform. Second one. And third one is long shift hours, means please the institution heads or the staff nurses, you try to have the balanced staff working hours. Like we are thinking like, yes, we are getting some extra payment, so today and tomorrow also I will continue. So today, tomorrow you are continuing, but that the paid amount is healthy or unhealthy, because you have continued 24 hours. Is it really helpful for you or not? That is also we need to think. Okay, so that and all we need to plan, and we can solve the this 3 issues in the nurses. The next. Yes, overall, the 100 things we have pointed out again and again. Only thing is, this all things, if you are following in the nurses, definitely we can solve most of the challenges. In that, there is an increased recruitment. Workforce recruitment is very, very important. I believe most of the states in India is started doing healthcare professional recruitment. I think in previously, they used to take recruitments once in 10 years, once in 5 years, 7 years. But I think now, recently, government as well as private institutions also doing repeatedly recruitment. Okay. Next one is continuous training program. I think the teachers or the nursing faculty, everybody knows that continuous training program. Best examples, the INC is organizing simulation-based education, or some of the programs organized by the college levels like OSCE, OSPI, such kind of seminars or any kind of presentations. If you are try to attend, then definitely most of our training skill gap will be reduced and our quality output will be increased, and ultimately healthcare professionals can be healthy and safe and sound. Next one is fair workload distribution. This has to be managed at the leadership level and at management level. And next one is mental health support. I request my dear students and the faculty, whenever you are facing any kind of stress, any kind of difficulties, especially emotionally you drained and you don't have a capacity to continue, try to approach your friends, your colleagues, your family members, and try to solve your these mental health issues. And this support, even Mitra, such kind of some agencies are there, they will try to help you in mental health issues. And next one is recognition system. Definitely the recognition system should be there in our healthcare professionals, so that whenever suppose a nurse's day is awaiting, so during that time we have to give certain kinds of the appreciation to the good healthcare professionals, though it will be a good motivation for healthcare employees, and ultimately the quality of the healthcare also will be improved, and healthcare delivery system also improved. And apart from that, all our higher qualifications has to be recognized, and our trainings has to be recognized. Then we can reach to the higher level post also with this recognition system. Next slide, ma'am. Yeah. So, in especially when it comes to the role of nursing faculty in reducing the challenges, first thing is skill development and the training programs. Wherever you have an opportunity to have a training programs, try to attend the training programs. Never it will be wasted. Never it will be wasted. And try to be in the mentorship so that you will have continuous training, continuous, because never healthcare services or healthcare knowledge or skill is limited. It is having a very updated versions. So we need to update with this mentorship and continuous research and innovation from the college side, like PhD scholars and the PhD people. When they are doing continuous research and innovations in our nursing field, definitely we can reduce challenges to the 70%. Next slide. Yeah, this is, I think I have discussed already how nursing faculty can reduce the challenges in the education system, because this generation students, wherever they are there, this generation handling is not an easy task. Every healthcare professional, hospital said how they have to train with the missions and the equipment, and nursing faculty also has to be trained with certain kinds of skills. And most of the teachers, the old strategies like shouting the students is not a criteria. That has to be changed. Really, I have changed my pattern of teaching once I have attended the training program of simulation-based education. I understand that the student's perspective, and I started teaching according to the student perspective. So ultimately, the quality of education will improve, quality of healthcare services also can be improved. Next slide, ma'am, please. Yes, I think in the audience, I would like to ask any one of you want to discuss any other important missed points, because we have discussed several points which are whatever is facing by the healthcare staff. Among that, any one point you would like to discuss or any other additional points you want to add? Any audience? Still any other points we are facing challenges? Yes, ma'am. Anybody want to discuss any other points the healthcare professionals are facing?
यस मैम क्वेश्चन
Yes, yes.
मैम अभी जो वर्कफोर्स आ रहा है हॉस्पिटल्स में कॉलेजेस में वो आ रहा है अभी जेनजी उससे अपन कैसे डील कर सकते हैं, क्योंकि उनका बिहेवियर नेचर बिल्कुल ही ओल्ड जनरेशन से बिल्कुल ही अलग होता है, उनका पैटर्न अलग होता है, काम करने का नेचर अलग होता है.
Yes,
हाउ टू डील विद देम?
Yes, Mr. Manish, very important challenge, especially even the nursing college side and hospital side. Both side, the facing important problem is this one only. Very important point you have raised. This Gen Z kid, they are built with different moral values, which are completely different from older generations. I request this Gen's mind setup has to be changed by the nursing faculty only, because once they join with intermediate, after that in the first year, each and every area we need to have a patience to correct the students. And see, best example, I'm not just an example I'm telling. When a dog can be trained to do such kind of activities which is ordered by the owner, and we are human beings and we are highly intelligent persons, if we put an effort, our Gen Z kids also can change. With this example, I want to say my kids are like my first year BScs and other students. when they joined in the first year, compared to first year, the third year and fourth year, they have lot of people have changed. And only thing is that we have to change with the positive reinforcement. My dear Ganesh, I think Ganesh or who has raised this point. So you have raised a very important point. These Gen Z kids need to be trained with discipline, need to be trained with the code of ethics of nurses. So these 2 points, if we are focusing and we are making them reinforcement with positivity, definitely we can reduce this challenge for 50%. This is my prediction, because we are forcing them not to smoke. Instead of not to smoke, there is a way to explain what are the consequences of smoking and how it is effect on the society, effects on family. With a positive reinforcement, I believe not 100 students will change, but among that, you can see the 10% of the population changed also, you have achieved that goal. Yes, my point is, yes.
Ma'am, one question more.
Yes, yes.
Ma'am, how can improve hospitals area critical skills?
Sorry, can you repeat that again?
Ma'am, how can you improve critical skills in the hospitals area?
Yes, very important thing. Critical skills, if you want to learn, you have to have the proper clinical training according to the INC curriculum, because INC curriculum has designed by a multiple, the highly qualified professionals. If they give one subject for 180 hours or 200 hours, within the 200 hours, we have a specified skills, medical ward, ICU skills. So if the nurses are able to fulfill that required hours according to that, and the skills, the critical skills has to be gained with the years of experience. 1 point. And second point is that individual student or a nursing officer should have consistency in learning. Consistency in learning. Suppose I am a principal of one of the institution, and if I am not teaching 15 years back, 20 years back, if I taught, and now I am sitting in this chair, and today all of a sudden, if I want to go and teach, I cannot teach. My skill, either critical skill in the hospital side or critical skill in the teaching, it has to be consistency. We should have the learning continuously. Never learning is an ending process, so it has to be continued. So what I am telling is, even the student nurses also should get an opportunity to have in the real life experience. This can be achieved when you give opportunity to the student nurses in the hospital side for giving injection techniques supervised by a staff nurse or supervised by any nursing faculty. So what will happen? They'll learn the critical skills. Is that my answer is judgeable or
Yes,
still
ma'am.
anything?
Thank you, ma'am.
Yes, yes. Anything?
No, ma'am.
Anybody want to discuss any other day-to-day life challenges in your particular
Good
area?
afternoon, ma'am.
Yes, good afternoon.
Am I audible?
Yes, yes, Ganesh.
Madam, this is Manish from West Bengal. I'm a faculty from one medical college in nursing department. So,
Okay.
ma'am, I just want to give one stress about your point, and you explained very nicely. And
Yes.
that the point is, ma'am, that I'm quoting your line that nurses need to upgrade themselves, and also learning process should be continue. Like
Yes.
today, nurses are oftenly they feel like overshadowed by other professionals. I'm not mentioning the other medicos, even
Yes.
though they possess extensive hands-on clinical experience and are directly involved in real-life patient care scenario. So they are the means we are the nurses are facing the patients, and we have so much of knowledge,
Yes.
like clinical, means especially clinical, and their practical insight experiences are invaluable and should be
Yes.
documented and published in academic journal as a research paper also, so that we can also learn as an academic, as a other professional also, they can learn their experiences. This should not only contribute to the advance of healthcare knowledge, but also empower nurses professionally. So nurses should never feel they are less important than other healthcare professionals.
Yes.
Ma'am, actually, when we visited to hospital, so all the nurses have the knowledge, but they always feel like, no, this, I think if I do this thing, so somebody shouted on me. So these kind of things always overshadow them. So make meaningful contribution to the healthcare system. It is a time for nurses to take forward and take the lead and showcase their true potential. Yes, the same way, ma'am, we are also implementing our student nowadays, like case presentation. We are starting a new things in our colleges also. Like they go and take cases, and we are like 7 day case choosing, and then we are doing an article and presenting like with them. So this is the point, and thank you so much, ma'am. You explained very nicely, ma'am. Thank you so much.
Thank you, Mr. Manish. You have added a very valuable, important point. Yes, even the nurses should contribute for research, so that we will, in our field itself, we have a different innovations. And when you have a different innovations, ultimately, our nursing profession also get recognized, and we will be confident in our own field. So I believe that your point is a very strongest point for reducing the. Yes.
Thank you, ma'am.
Yes. Yes. Anybody? So can I wind up the session, or anybody wish to specify any important points?
Yeah,
Ma'am, I have
hi,
one
ma'am.
questions.
Our session has been good initiative. So wish you all the best and keep initiating these kind of programs in the future also.
Thank you, Mr. Anybody wish to specify anything?
Ma'am, I have one question.
Yes, yes, please.
Ma'am, how they we can manage the communication manner and communication skills during the clinical posting in all nursing staffs, with the all nursing staffs in any kind of situations.
Yeah, this communication is always we start in the first chapter in our nursing field itself, that communication plays a very important role in providing the quality of. Yeah, so here I would like to say, is communication or language you should learn in the college side. That is why the teachers are correcting that you should talk like this, you should not talk like this, and you should use this kind of words, sympathy, empathy. So such kind of things you should learn in the college level. Then only that process. Here you are just giving a back answer, or you are giving very good answer. What is happening? This same communication process you will implement in the clinical side also. When it is implemented in the clinical side without sympathy, empathy, your communication is waste only. And the other thing is, when you don't use the sympathetic or empathetic words in your communication process seems like rude. Because whenever you are visiting the hospital, definitely a patient is in a pain. Patient is in a crisis. So when you are doing the sympathy, empathy, communication, obviously your interaction with patients will be good, and patient will be give a very good support in providing any kind of medications and taking any medications or any kind of strategies also. They will be very helpful, really. So what will happen is patient recovery is good. When patient recovery is good, patient turnover also will be good. Patient turnover is good, and ultimately our institution name and fame also will be good. I believe communication, how medications you are giving, how surgery we are doing, apart from all this, communication plays a very important role. I speak very boldly that in your communication, these two qualities we need to develop: sympathy and empathy. Sympathy and empathy, most of the time we are not using these two qualities in our communication because of the shortage of the staff, because we are already frustrated with 100 patients and one nurse. So what is happening? Our way of language is completely changed, because repeatedly the patients are asking same questions, because patients are in the crisis. Patients are in the pain. Their situation is like that. A nurse is a good, important person which plays to reduce their stress, to make the person comfortable. So I believe communication, verbally, non-verbally, any method you can use with the touch or with the speak. But try to develop these two qualities in your communication. I strongly believe that this will make you more beautiful nurse when you are accompanied with a skill. Is that clear, ma'am?
Yes, ma'am. That means, ma'am, its overall communication is depend totally into the sympathy and empathy. Without sympathy and empathy, communications cannot effectiveness in any kinds of people in that particular space.
Yes, yes. Because if you go to movie, if you go to the theater, sympathy, empathy words are not so important. But when it comes to the pain, when it comes to the hospital environment, the patient needs these two important type of communication so that the patient will feel comfort in your hands. So I believe in that. If you provide that, definitely these two qualities make you different nurse from others. You can try and definitely you see the difference from the patient care. Any other things, ma? Anybody?
Thank you, ma'am.
Yes.
One question more. Culture is also major role play in health delivery care system. How can overcome it in rural area and provide a better health care from the people?
Yes. So culture is not in the present generation. Culture is a very important factor in healthcare delivery system itself because we initiate certain kinds of strategies. Best example, family planning methods. So some culture or some areas of the rural area, they will not accept certain kinds of healthcare practices. Best example, you are initiating the family planning methods of temporary or permanent family planning methods to certain families, they will not allow you to change at all. So in that care, we need to be follow legal, ethical principles to make them understand. Yes, it is a toughest challenge for the healthcare professionals because they are not ready to accept your change or they are not ready to accept your things which you want to implement. So it is a strongest point, but you need to come up with patience. We should be patient to explain. Best example, so many cultural areas like some religions, they will not accept permanent family planning methods like tubectomy and vasectomy. But if healthcare professional is explaining very nicely, and definitely that culture we can break down also, and they will try to. We have seen a lot of even families where they have break that cultural or traditional systems, and they have accepted the healthcare system according to our wish. But it requires the patience because you say that family planning method should be done for this so and so religion. If they are not ready to accept, you cannot implement. You have to be patient. You have to explain properly. Then I think that culture also we can achieve if you have a communication skills and if you have a skills to convince them. Gautam, is that clear or still need any explanation?
Ma'am, I have one more questions regarding the nurse. In this time, so many people in our rural area, they can judge you are only nurse. You cannot do anything in your futures. Your futures is just like a dark. So, ma'am, in these conditions, what can I do in this type of peoples?
Okay, so you have initiated one healthcare service in the rural area. If they are not accepting being a nurse, what you want to do? Yes. This is what
Yes,
your question, right? Yeah. So
yes,
yeah, that's a very good point. Not only in the rural area, most of the time, even urban area also, slum areas, they are not ready to accept nursing or nursing officers' instructions. Yes, it is true, but I think this trend is long back. But right now, all the professionals, they are accepting equally. But if you are facing such kind of challenges, you need to judge yourself or you need to justify yourself that you are one of the part of healthcare professionals. It is that we have different cadres, but every cadre have their designed work role, and they have their designed strategy to work out. You need to explain and explain. Best example, In one way, the hero is appreciated. At the same time, hero side comedians also is appreciated. It doesn't mean that the movie is only run by the heroes. The content means the nurses what we have a knowledge, and the second thing is the comedian, the person who is doing the skill or the person who is doing the task, that is also impressing by the audience. That means we are the persons, we should impress our behavior, our quality, our education by the others. Definitely we can control that challenge also by using our behavior. Suppose you are not looking like a nursing student, you are not looking like a nursing officer, and you are looking completely different. Is that behavior will be accepted by the rural people? No. It is very difficult because your behavior and your presence also make difference from others, and this challenge of unacceptance can be reduced with your body posture, with your behavior, with your knowledge, with your skills. Yes, we strongly believe two nurses are going for one patient for giving injection. That patient will say that no, you don't want, I need that sister. These two are sisters only, but why the patient is selected other sister is makes her behavior, her communication, her discipline, her skill, her knowledge. So I believe these all qualities, if nurses or healthcare professionals are having, we can reduce so many challenges. Is there any other things? Are you happy with my explanation, Gautam?
Yes, ma'am. I agree with this. Thank you, ma'am.
Anybody else? I think I have given a clarity. And apart from this, anybody wish to say anything?
That means, ma'am, you can guide me the totally conclusion in this type of conditions in any particular area. To maintain in this type of conditions is depend only the communication skills, sympathy, empathy, and behavior also included.
And other two important points I have mentioned, knowledge and skills. If you have sympathy, empathy, but you don't have a knowledge also, public will not accept. I am the one example I can say. The Dr. Anitha doesn't have a knowledge. Dr. Anitha doesn't have a skills. Is that my 800 students can accept a principal like this? No. They will not accept, because if person is not having a knowledge or capacity or the communication, it is very difficult to convince the public. So these all qualities nurses should have. Definitely the nursing will be appreciated everywhere. Ma'am, can you go to the next session, ma'am, please? I think it is going to be 1.5 hours.
Yes, ma'am.
Yeah, please. Next slide, ma'am, please.
Next slide, yes, ma'am.
Yeah. Yeah, that group members, still anything you would like to discuss, I'm ready to answer it.
Slide, ma'am. Wait.
Yeah, fine, no issues. So the overall, my session is only dealing with this summarizing points of strengthening the regulatory framework, like nursing colleges and schools should have a good standard colleges and with a good lab setup and good faculty, so that we can produce a highly skilled healthcare professionals, and ultimately the quality of the patient care, quality of the institution also will be increased. That's the first point. Second point is enhancing professional development. I encourage always the professionals or healthcare professionals should have the higher degrees, higher skill training program, so that we will be confident. Next one is improving remuneration. I believe that most of the states also has revised the schedules of the remuneration. And the next one is technology. And yes, in Indian nurses, we are lagged with the technology because we are not aware of that how to operate the machines and all. But when you go to the clinical side, when you have a skill opportunity, then you try to learn certain kinds of things by using the technology. Next one is retention support program. Retention support program, whenever the staff turnover is very high from the institution, then we need to say that what strategies we need to maintain to retain that employees in your institution. We should have our own strategies. And next one is empowering the nurse leaders. I strongly believe in this point. If we have our own governing bodies, that I think 5-6 years back, most of the nursing councils and the universities completely operated by the doctors. So what happened, even when I studied my BSc nursing, it is operated by the doctors. So what happened, the doctors have their own level of standard and we are not able to match with their knowledge. So there is a huge gap between the medical college knowledge and the nursing college knowledge. So it is causing a lot of crisis in the nursing colleges. I think we have our own governing bodies and we have our own leaders. Definitely our quality and our healthcare professionals quality also will be improved, and academic and financial support also is one of the strategy to solve most of the challenges. Like academic is strong, then we are confident enough to handle any kind of situations. And financial support, best example, INC is giving almost 38,000 for training a one individual. So when certain governing bodies like Indian Nursing Council or Bihar Nursing Council or West Bengal Nursing Council or Andhra Nursing Council, when they are ready to initiate with financial support of any training programs, I request my students try to attend so that we will be upgraded and we can be strong enough to sustain this challenge, to sustain or fight with the challenges. Ma'am, next slide, ma'am. Next slide, ma'am. Yes. So I think before this slide, thank you. Before slide, ma'am.
Okay, the conclusion one, right, ma'am?
Yes. So the conclusion, I would like to conclude this topic with, I know everybody knows that healthcare workers are the backbone of the healthcare system. So I have addressed all the challenges and I have given certain strategies also. Yes, all the strategies we cannot implement, but in our hand, whatever strategies are there, that if you are trying to implement, then we can be strong and we can be achieve all these challenges and we can be a good healthcare professional. And in that, for important point, I would like to say, my dear healthcare professionals, prioritize your self-care, because most of the time nurses are busy in providing services to the others and we forget ourselves. So if you want to be healthy, the first point I believe is that prioritizing self-care. We should think about ourselves, and whenever you have any crisis, seek mentorship or take help of anybody. Even my dear students, if you have any crisis, tell to your teacher, tell to your friends, and focusing on building confidence. Confidence will come only with the knowledge and with the skills. And next one is, whatever available resources are there, you try to utilize it so that the healthcare professionals can be strong enough to achieve all these challenges. I believe I have addressed all the points, and I would like to conclude my topic. Is anybody else want to speak anything? Yes, I thank everyone for the participation in this live webinar, and I'm going to conclude this topic with this. Thank you all.
Thank you, ma'am.
You will get the participation certificate in the register mail. You can wait until they provide. It will take 1 or 2 days time to give from that. Is there anything else?
And by the time we have shared the review form, you can fill the review form also. So Anitha ma'am, wonderful session. And seriously, this session has been gone very nicely because we got the, like everyone has done the cross questions and all. Because when people used to ask the question and when the speaker used to like satisfy them with their answers, then only the session looks good, ma'am. Only simply coming and just making the PPT and just the people and just they won't, when until and unless the audience won't ask the question, we can't say that we all are satisfied with the things what we have learned in our day-to-day life.
Yes, ma'am. Thank you, ma'am. Manisha ma'am, thank you for this opportunity to be a part of your service. And definitely it is a good achievement in my life also. And thank you, my dear students, for this participation till ending. I know that there are some more points, if I am standing, some more points will be raised by our nursing students. I think I have covered all the points. That's why I'm winding up this session. Still, anybody want to ask anything else, ma'am?
I think no one is having any question, ma'am.
Yeah, well, it's a good enough, important and useful session. Please organize the same sessions in the future also.
Definitely, we will come up with a new topics.
Thank you. Thanks
Okay,
for-
so we will wind up the session for the day. Enjoy everyone. Happy weekend and good day ahead. That's all.
Thank you. Thank you, ma'am.
Okay. Bye.
I'm leaving. Thank you all.
Yeah, ma'am. Okay.
It's very nice session.
Thank you, ma'am. It was a nice session.